Welcome to our community broadcasting network featuring the Health and Wellness Best Practices podcast. I'm your host, Dennis Streeter. Today's program will feature the Colorado Behavioral Health Care Council, a membership organization for mental health services providers. The CBHC's overarching mission is to support community resilience, guide behavioral health innovation, and enhance individual well-being throughout Colorado. Visiting with us today is Edie Sun, Senior Director of External Affairs for the Colorado Behavioral Health Care Council. Edie, so happy to have you with us today. Thanks for being.
Thank you, Dennis. It's a pleasure to join you.
Why don't we start out by you giving us some history and background of the Colorado Behavioral Health Care Council. You've been around a long time, haven't you?
Yeah, we have, Dennis. So the Colorado Behavioral Health Care Council, I'm going to call us CBHC, has been around since 1967. And we are the statewide membership association for the not-for-profit, community-based providers of mental health and substance use disorder treatment. And I think it's important to explain why these organizations exist and how we came about. And that is really in response to the very last bill that President John F. Kennedy signed before he was killed in 1963. So the Community Mental Health Act was the first policy aimed at saying individuals with mental illness should not be warehoused in institutions. We need to establish community-based outpatient systems of care to care for most of these people. So that bill established the community mental health system, made community mental health centers like the ones I represent embedded into federal law. And the challenge was they made us a part of the federal law, but there was never any dedicated federal funding for these new entities, which has caused challenges with the system over the decades. But that's who we are. So our folks, as these safety net providers, are there for everyone in their communities, but particularly the most vulnerable. So adults with serious mental illness like schizophrenia, schizoaffective disorder, things like that. Children with severe emotional disturbances. And individuals with significant substance use disorder. So we provide an array of both direct services and wraparound care to help these individuals get back on their feet, get housing, get education, get employment, recover as they define recovery. In addition to also being there for our community in terms of crisis response or taking care of individuals with private insurance. We try to serve the entire spectrum, but our niche, our sweet spot that nobody else fills is the outpatient and residential care for the very sickest among us.
Okay. Now, you're a member organization.
Correct.
You have member nonprofits, as you mentioned, that you help provide all this. How exactly does that work?
So at this point, we have 17 members, 16 community mental health centers, also known as comprehensive behavioral health providers, and then one specialty clinic, Servicios de la Raza, which doesn't fit those exact criteria, but plays a crucial role in Metro Denver and Pueblo in providing mental health support to the Latino community. And what CBHC then does is try to enable our members to provide those direct services. We advocate at the state level to ensure the structure and the financing that enables our members to serve those vulnerable individuals in their communities. So we lobby, we work on regulatory issues. We work at both the state and federal level on policy and funding, as I say, to ensure that our members can fulfill their mission.
All right. So again, you do a lot of the work that they can't do in, the advocacy side and information gathering, which
Right.
is really, really important. What are your top priorities?
CBHC's top priorities on behalf of our members really fall into two buckets. One is mending the safety net, and the other is funding the safety net. So when I talk about mending the safety net, what I'm really talking about is trying to ensure that there is a continuum of care for the most seriously mentally ill that goes beyond simply the services our members provide. Because again, our members are primarily outpatient providers. Some of them operate residences and group homes, but primarily it's that outpatient care. Well, you think about individuals with serious mental illness. We see those people cycle in and out of jails, homelessness, the state mental institutions. And over the years, some of the continuum of support and care that can help those seriously mentally ill people get the care and treatment they need have been frayed. So, for example, we've lost so many of our inpatient hospital beds, not only at the mental health institutes in Pueblo and at Fort Logan because of scarce federal funding, but even private hospitals in our communities who used to have inpatient psych beds. Over a period of years, most of them shut down those units. Some of them are starting to restart them now, but we still have way too few inpatient beds for people who need inpatient care for a month, 6 months, or longer. So we need more of that. We need more secure residential facilities and therapeutic residences. We need more support from courts and jails and law enforcement to help us get these people to the places where they can get the care they need. So when we talk about mending the safety net, we're really trying to knit back together that continuum of care. So that's one priority. And then our other, as I said, is funding the safety net. Safety net behavioral health care in Colorado has never been fully funded. The challenge is exacerbated by the restrictions that Tabor places on our state budget. So there's less of that discretionary funding there to, for example, support the services the Behavioral Health Administration pays our members to do that aren't covered by Medicaid. Those important wraparound services, like I was talking about before, housing, employment training, education, things like that. So we've got that ongoing challenge that is really exacerbated now because of Colorado's structural budget deficit. Our state legislature is in the process of closing a $1.2 billion deficit in the state budget. And in order to do that, they've had to pull back on many programs across state government.
As a member of the Behavioral Health Planning and Advisory Council, we deal with a lot of the biggest single issue that we deal with is our rural and frontier areas of the state.
Right.
How do these people get services?
Right.
So, I mean, that's got to be a real struggle for you guys.
Yeah, absolutely. So, we represent providers across the state. So we have members serving all of rural Colorado as well as the urban corridor down I-25. Um, and it's exceptionally challenging for them. First of all, um, the prevalence of Medicaid in rural Colorado is even greater than in urban Colorado. So rural members are even more dependent upon those Medicaid reimbursements to serve the people in their communities. And, we have members that cover 10, 12 counties. And in the face of these funding challenges, it becomes even harder for them to do that. Let me give you a for instance. So one of the funding challenges that took place that reared its head last year that I didn't mention earlier was when the public health emergency related to COVID was officially ended by the federal government in 2023. They gave state Medicaid programs a year to say, okay, during the public health emergency, we didn't require you to check Medicaid members' eligibility. We allowed you to keep everybody on Medicaid, but we're going to have to go back to checking folks' eligibility for Medicaid. Makes perfect sense. And everybody knew it was going to be coming. And our members and other safety net providers had a year to plan for the unwind, as we called it. And we planned based on the projections we got from the state about the rate of disenrollment we could expect to see. And the state projected a disenrollment rate that kind of went down like that, gradual, but, dealable. And so that's what our members planned for and budgeted to. And in some parts of the state, that was the slope of the disenrollment curve. And in other parts of the state, it was much different. It was much steeper. And as a result, some of our providers found themselves facing multi-million-dollar shortfalls. So one of the rural members did everything they could to right-size their budget. Their executive team took pay cuts. They consolidated services. They reduced their administrative costs, but that consolidation of services meant that they had to limit the hours at a couple of their clinics out on the plains. They didn't want to do that, but they had to spread their staff more thinly. They couldn't afford to keep all of these facilities operating as much as they had been. Some of our other members had to lay off staff. They didn't want to do it. They did everything they could to avoid it. But so these challenges really exacerbate the access problems, because whether you're urban or rural, you've got people coming to you saying, I need help. And members are saying, we want to help you. We are here to help you. And we don't have the same resources to do so that we used to.
As advocates, and yet you are a member organization, you advocate for the patient as well. You want to let me know how that works?
Oh, absolutely. And I'm so glad you raised that, Dennis, because of course, our people are the ones who serve the people. So at the end of the day, everything we do and every priority that CBHC has is to support the care that vulnerable individuals in our communities need. It's always about how do we ensure our members are able to continue providing those services. And it's also about how do we partner with the organizations who advocate on behalf of the patients. So we work very closely with Mental Health Colorado, the Colorado Cross Disabilities Coalition, a number of other groups who advocate on behalf of vulnerable individuals to see how can we partner together. There's one group that I am particularly excited about partnering with, and that's Colorado Mad Moms. And it's a great name, right? You know, mama bears defending their cubs. And these are the mothers of adults with serious mental illness. The folks who are falling through the holes in the safety net that I described earlier, because we've lost that continuum of care from inpatient to residential to the outpatient. We don't have enough of those beds for people who are seriously mentally ill. And so these are the mothers of the people who are cycling in and out of jails and the streets, and jails and the streets over and over and over. And a jail is no place for somebody with serious mental illness to be. And so we have, I would say, the Venn diagram of our shared interests with the Mad Moms is, 100% overlap. And how can we work together to advocate for knitting back together this safety net?
So, Edie, a lot of great information about your organization. You have any final thoughts for us today?
Yeah, thank you, Dennis. I think the most important thing I want the viewers of this podcast to take away is an awareness of the crucial role that community behavioral health safety net providers play in their communities. Our folks are on the front line taking care of your family members, your friends, and neighbors. We're all affected by mental health, well-being, substance use challenges, some of us more than others. And if we don't have a strong safety net, the individuals who most need the care can't get the care. So let's all focus on understanding the importance of the safety net and ensuring that safety net providers have the resources they need to serve those vulnerable people in our communities.
Great, great. And I put up information about your website. I think you have a terrific website.
Oh, thank you. It's going to be more terrific soon. We're in the process of updating it.
Okay, good. But there are some interesting programs. So I encourage people to visit your website and learn more about what you do. And actually, it's very empowering because it also indicates things they can do.
Yeah,
And I
thank you.
think that's as important as anything else. So, Edie, thanks
Agreed.
so much for taking the time to be with us today. And I hope you'll come back and do this again.
Thank you, Dennis. It's been my pleasure to be here today, and I hope to come back.
For more information about the Colorado Behavioral Healthcare Council, visit www.cbhc.org.